Thank you.
Good morning, students. I am Dr. Sujata. Today we are going to discuss about polio. As you might all know, polio, it is a food and waterborne infection. As you might all know this, polio is a well-known disease. Polio, it is a viral disease caused by polio virus. It is a food and waterborne infection. It was first discovered by Michael in 1789. It mainly causes paralysis. Next, coming to the definition, it is acute infection. Acute infection means the disease which can spread easily. Fasterly transferred disease is called as acute disease, whereas chronic means the disease which carries a lifelong. It is a chronic disease. It is an acute viral disease caused by enterovirus. The virus which is present in the intestine is called as enterovirus. Why? Because the organism enters into the body through the ingestion. Ingestion means intaking of contaminated food and water. So the word myelitis means inflammation of spinal cord. So the meaning of poliomyelitis, it is a Greek word. Polio means gray matter. Myelos means spinal cord. There is an inflammation of spinal cord. So it is called as poliomyelitis. The transfer route is fecal oral route. Especially it is a ingestion, intaking of contaminated food and water. Poliovirus causes poliomyelitis. Poliomyelitis is the disease which is caused by the poliovirus. It is an enterovirus. It belongs to the family Picornaviridae. Picornaviridae is the family of poliovirus. Next, it is a viral. The viral diameter is 30 nanometer in diameter. It is a single stranded RNA virus. Okay. Then we are studying about genus enterovirus, species poliovirus, structure. It is a single stranded. Remember, it is a single stranded RNA virus. The capsid consists of single stranded RNA. The question may be like this: what is the genome of poliovirus? Single stranded RNA. There are three types of poliovirus: poliovirus 1, poliovirus 2, poliovirus 3. But the outbreaks are mostly common due to poliovirus 1. It causes paralysis. Next, coming to the resistance, this virus can survive along up to 1 year at 20 degrees centigrade, up to 1 month in freezers at 4 degrees centigrade. It can be inactivated by heat and chlorination of water. That means the chlorination of water kills poliovirus. The boiling of water is also kills the poliovirus. Next, coming to the mode of transmission, it mainly transferred through fecal oral route. Previously, it was believed that it can be transmitted through respiratory secretions, but nowadays we can recognize polio is a disease of intestine. Next, coming to the period of communicability, up to 7 to 10 years before and after onset of the symptoms. Next, the age, most of the people are 6 months to 3 years. It is a seasonal disease. Most of the season is July to September. It is most common in July and September. That may be of a rainy season. Next, environmental factors. What is the environment? Overcrowding, poor sanitation, flies, contaminated food and water can transfer the disease. Next, coming to the pathogenesis. Pathogenesis is the science which deals about how the organism causes disease. Next, pathogenesis of the virus. The organism enters into the body through contaminated food and water through mouth. Then it enters and multiplies into the local multiplication. That means tonsils. Then the virus enters into the blood. That is called as viremia. There it gets multiplies in the lymph nodes and enters. Secondary entry of the blood is called as secondary viremia. Then the virus enters into the brain. From there, from the brain, it enters into the attack to the neurons and reaches to the spinal cord and destroys the spinal cord. So poliovirus mainly attack to the central nervous system. It doesn't affect any intestinal organs, but it multiplies in the intestine, pairs, patches, tonsils. It invades. Invades means it attack to the intestinal tract, lymphoid organs, but it mainly affects the central nervous system. The entry of the virus in the blood is called as viremia. Okay. Next, clinical features. We know about what is pathogenesis. Next, we have to know about clinical features. C bar F. The doctor will be write as C bar F. What are the clinical features? There are mainly two types of clinical features. One is inapparent. Inapparent means not exact symptoms can be appear. That is called as inapparent. The second one is apparent. Apparent means exact symptoms can be seen. So, apparent symptoms are divided into different types: abortive, non-poliolytic, and paralytic polio. Next, we are discussing about inapparent. Inapparent means asymptomatic. 90 to 95% of patients are suffering with inapparent. That means they doesn't show the proper symptom. Without symptoms, we can't go to the hospital. So most of the people will suffer with inapparent. Inapparent means asymptomatic. They are asymptomatic. They may carry the disease. They are suffering with the disease. They carry the disease, but they doesn't show any symptoms. That is called as inapparent. Next, coming to the apparent. Apparent means it shows proper symptoms. It is of different types: abortive, non-paralytic, paralytic, and polioencephalitis. Coming to the abortive polio is nothing but the minor illness. This question will be comes in exams about what is abortive polio. Abortive polio is nothing but minor illness. It doesn't cause paralysis. The person doesn't get paralysis in case of abortive polio. It mainly seen in the children. That means the virus doesn't enter into the central nervous system. The symptoms are low fever, sore throat, pain in the throat, vomiting, abdominal pain, loss of appetite. Appetite means hunger, malaise, restlessness. These are the symptoms. The person may get recover. Next, coming to the non-paralytic aseptic meningitis. Meningitis means swelling of the meningeal layer of the brain. That is swelling of the brain. Next, the symptoms are headache, nausea. Nausea means restlessness, vomiting, pains, back pain. The person may be recovered in this stage also. If the person go to the hospital, the person may be recovered. Next, paralytic polio. Paralytic polio is of different types. There are two types of paralytic polio. One is spinal polio and other is bulbar polio. Spinal polio means the virus attack to the motor nerves of the spinal cord. There it causes paralysis of the legs and breathing problems. Breathing problems may be arrest. In case of bulbar polio, affects the neurons responsible for the sight, vision, taste, breathing. So the person, if the person get bulbar polio, the person will lose his taste, lose his vision. Next, polio diagnosis. How the polio can be diagnosed? In early stages, the polio can be diagnosed in throat. In longer stages, in case of viremia, the polio virus may be detected in blood streams. Next, viral isolation. Where we can isolate? It is a enterovirus. Enterovirus means intestinal virus. That's right. The virus can be isolated in the feces only. The feces can be collected. After few days, the viremia condition will be occurred. So we can take blood as the specimen, and then cerebrospinal fluid can be taken. Early stages, feces and blood. These are the main specimens. Next, we have to move for what is the treatment and what is the prevention of polio virus. There is a prevention of polio virus. We can't cure the polio. The affected person, we can't cure the person. So we have to prevent the disease. There is a different types of immunizations are there. Immunization is nothing but vaccination. So active immunization and passive immunization is also there. Active immunization, it was discovered by SLAC and Sabin vaccine. SLAC vaccine, SLAC means it is a killed vaccine. This vaccine is given to the baby born with any HIV, hepatitis B, jaundice, any other diseases. Sabin vaccine, it is nothing but oral polio vaccine. Oral polio vaccine, we can say, రెండు చుక్కలు ఒక నిండు జీవితం అంటే చూడమ్మా, అది oral polio vaccine. It can be given orally. 0 to 5 years babies can be given. It was discovered by Albert Sabin. It is a live attenuated vaccine. Next, coming to the treatment. What are the treatment? What the treatment we have to give to the polio affected person? That is antibiotic therapy. Antibiotic therapy for urinary infection. There may be itching in the urinary gland, urinary secretions. So the patient can be treated for urinary tract infection by using antibiotic, and we have to apply moist heat. That means heat pads, warm towels to reduce the muscle pain and spasms. Spasms means stiffness of the muscle. If the person got spasms on the limb, then we have to keep the warm towel to reduce the muscular pain. Painkillers can be given to reduce the headache, muscular pain. Most of the patient can be given to the sedation because he can't tolerate the pain. So physical therapy, braces, corrective shoes, orthopedic surgery will be helpful. Mainly physiotherapy. Physiotherapy is given to the polio case to weaken the for weakened muscle, to give the strengthening of the muscle. Next, Amma, just we have to discuss about mostly the vaccines. Amma, vaccines plays an important role in case of polio that we already discussed. Slag vaccine and Sabin vaccine. Sabin vaccine, it is developed from the monkey kidney cells. Booster doses can be given. It is a live attenuated vaccine. The vaccine is given to 0 to 5 years babies. Next, Amma. Sabin vaccine, it is an oral vaccine. Amma. Slag vaccine, it is a killed vaccine. We have to give intramuscular. It can be given for 2 to 3 years. We have to give in Western countries. It was banned. Amma. In only India, we can use oral polio vaccine. Oral polio vaccine. It is a pulse polio. We can say every weekend, Sunday, February from the February month onwards, our government, WHO, World Health Organization, Polio Sunday. That time, the government will use pulse polio vaccine freely to all the people. Wherever you go, the polio vaccine will be available in railway stations, bus stands, whatever places. So, inactivated vaccines. Some cases, slag vaccine can be given if the baby is born with HIV or hepatitis B, sexual disease or jaundice. We have to give only slag vaccine. It is a killed vaccine. The organism can be inactivated by using formalin. Formalin is a chemical which inactivates the polio virus, which can be used as a Sabin vaccine. It was discovered by Dr. Sabin. Next, what are the doses it can be given? It is a mainly childhood disease. The dose can be given to 2 months, 4 months, 6 to 18 months, and booster dose. Booster dose means the activation of the already given doses, that is called as booster doses. Next, this slag vaccine can be given as an intramuscular vaccine. We have to give slag vaccine. It is a killed vaccine discovered by slag. Next, polio vaccine. It is good for health and it also gives good taste. So, we can't treat the polio, but we can prevent the polio virus. So, you must aware of this polio and give polio vaccine to your children and educate all your surroundings and societies about this polio vaccine. Thank you.